On Saturdays from 3 to 4 p.m., I am Dawn Reese with Hollywood Connections. My show is exciting. We have major stars, major artists, major movie producers, agents, casting directors. I even help cast for Home Shopping Network. You might be on that show as well. We have new talent segments. Be discovered. Remember Hollywood Connections on Saturday from 3 to 4 on Tan Talk Radio. I'm Dawn Reese, your host. Tune in.
This is the Tan Talk Radio Network.
The Karen Rizzo Show on the Tan Talk Network. This is the show for seniors, caregivers, and their families. She is the author of the best-selling book, Aging in America, Navigating Our Healthcare System, which is available at Amazon, Nook, Kindle, and at agingguidebook1.com. Having worked over 20 years in the industry, she has the insider information about the healthcare system and how it works, and will help you navigate around the business side of aging in America. She also works as a patient advocate, consultant, and educator. Now here's your host, Karen Rizzo.
Good morning, Tampa Bay. Thank you for tuning in to the Karen Rizzo Show. The show is based on my book on navigating our healthcare system, and it's really focused on helping people understand the business and the hottest topics on the aging process and all the new latest tools that are out there. And really, we've had the full spectrum over the last few weeks on elder law, assisted living, home care, the finances, the VA programs, and some of the different programs that can help us as we try to age gracefully and wisely and in charge. If you're interested in getting a copy of the book, it is on Amazon, Kindle, Nook, and at agingguidebook1.com. And you can also, if you want to tune into any of the other shows, if you have a question, you can always look at the podcast, which is on the tantalknetwork.com, and also on YouTube. You just need to scroll The Karen Rizzo Show, Karen with a Y. My parents were hippies, sorry. Can't help it. So this morning, I'm excited, though. We are going to be talking about the role technology is taking in for caregivers. We know that the average lifespan is longer than it ever used to be in history, and it's 99.3, so we're getting more 90-year-olds with us, more centenarians with us. We're getting people that are living longer than they ever have in our nation's history. So that also means there's a lot of adult children that are being thrown into a caregiver role. Today I have Monica Stynchula with us, and she is the CEO and founder of a tool called Reunion Care. She's a really remarkable woman because she's has more degrees than I can even attest to here. But more importantly, she's on the AARP Foundation board. She's very involved in the community. And Reunion Care is a tool that I thought would be very helpful for the listeners because here in our area especially, we are seeing a lot of caregivers. So thank you for being with us today, Monica.
You're welcome. Thank you for having me, Karen.
Yeah. So for those that have access to a computer, definitely get on there, and I want you to tell us, somebody who doesn't know anything about Reunion Care, what do they need to know?
What they need to know is we are here for you. We are here for your family. Reunion Care is family-based care management. I'm a clinical social worker who retrained in health information technology. Okay. And to me, it's really important for families to understand, to use the power of technology to help take care of their seniors. So what we've done is we've created a tool that we have tested in time after time with senior user groups to make it as easy as possible. So when you go online, it's reunioncare.com. You go up to the top across the navigation bar and you find sign in on the right hand side. And when you find that, it will lead you through how to create an account and how to invite your family to join in on creating a circle of care for your seniors.
Yeah, and a couple of weeks ago we had elder law attorney Jack Rosencrantz on the show, and he was the one who said, remember, Karen, the two universal truths that whenever somebody says it's not about the money, it's about the money, and whoever travels the furthest is probably going to be the angriest, especially in a time of crisis. So what I love about your tool is it's really a way to help the other adult children, other family members, or support groups be involved in this whole process, even if they live out of state.
To me, that's really important. Very few of us remain in our hometown where we grew up, but we left our parents behind in many cases, or our parents moved off to somewhere like sunny Florida to live out their
to retire.
That's right. That's right, and it's a great place to be. However, if your children aren't around there to help you on a daily basis, all of a sudden those tiny tasks that seemed like nothing when you were surrounded by people you love to help you get to the grocery store, to take you to the doctor's appointment, to answer a question, when they're no longer available on a daily basis, now we have some new barriers, we call them gaps in care that we need to close. And we can do that. We can do that effectively with technology, but it's a matter of getting on there and starting your own account to make sure that happens.
Right, and one of the key features that I liked about it was that it actually has the ability to upload the health care professionals that are taking care of mom or dad, so that, say somebody out of state is maybe they work in the healthcare system, so maybe they're the best person to be speaking to the doctor instead of whoever the primary caregiver is. Now, not to take away from the role of a primary caregiver, because they have a really tough life there. So it is reunioncare.com. So that's REUNION care.
Yes.
.com. All right, going on there like I'm a rookie here. So that when I crossed your path and we were able to go on to here, I realized just how flexible of a tool this is. It's exciting to think that it could be used for not just a senior, a adult person that needs care, that needs help, but also even an assisted living community potentially.
That's right.
So
that's right, because that communication, no matter what the setting, is very important. You need to know or most of us want to know what's going on a regular basis. And so we've built this tool based on a daily life of a senior. So we worry about your orientation skills, about your activities of daily living. How are those going? Are you able to dress yourself? Are you able to feed yourself? What do we need to do to bring in there if you're not able to do those things? Do you need help getting to the grocery store? And the other important part, we know that falls are a major, very costly injury and can lead to a cascading of events that are just disastrous. And so we have environmental tools on there to make sure that your home is safe so you won't fall, and also that it's secure. Is there adequate lighting? Are the resources in place? That's right. That's right. The grab bars in the bathroom, railings on the staircases, skid plates on skid pads on the bathroom floor so that you don't slip and fall in a wet surface. You know, all those things are very important. I want to go back to something you said earlier about the primary caregiver and maybe someone from out of town's the better person. So let me tell you what happened in my family. My parents live in Pittsburgh.
Okay.
And even though I'm a middle child and one of 7,
wow,
who do you call in but the social worker?
Of course.
And it's not that my mother didn't love my father and that she wasn't up to the task. She was overwhelmed.
Yeah.
And I think a lot of us need to understand when your parents live at a distance, they may seem to be fine, but the reality is so much becomes overwhelming, especially when something as critical and as emotional as an illness comes along. All of a sudden, processing that information and making the right decisions becomes difficult. And so what I found is the reason why they called me in is I'm pushy. And
squeaky wheel.
That's right. And they knew that I would get things done. It wasn't in any way a slight on my mother and her abilities. It was, call in the tank when you need to go to battle.
Well, and in my advocacy work, that is what I find a lot of times is sometimes, it's an unplanned event. Nobody plans to have a stroke. Nobody plans to have an illness.
That's right.
Nobody plans to have a fall. And then they end up in the hospital. They've got all these doctors and nurses coming at them, testing them, labs, blood drawn, this, that, the other. And if they ask a question, sometimes they get 2 minutes with a physician, if they're lucky, and they might not ask the right question.
Right.
I mean, and that's just, and it's just because they don't know what they don't know to ask. And it's not anything against them being well-meaning. It's just that when you are in the healthcare world and you have that training like you do, myself and I do from the nursing home world, but you do know what questions to ask. I mean, and it's amazing to me, I've had families that were friends with the CEOs of hospitals that couldn't get answers. And I've come in there and in 2 minutes, I'm like, boom, okay, call in the specialist. And you're right, it is the squeaky wheel. Right. You do have to have somebody in there that can, ask the tough questions, call in a second opinion if you need to, whatever the case is.
Right.
But I'm sure your parents were so glad to have the help.
Well, I think they were. if you can step back in those kind of emotional situations and think, my mother wasn't just my father's caregiver, but she was losing the man she loved of 63 years of marriage.
Wow.
7 kids.
Oh
I mean,
my goodness.
they've been through a lot together, and just what she had to process, just what
Right.
was going on for her was enough for one person.
Right.
The expectation that she would give perfect care to my father on top of that was just so unrealistic. So let me tell you how it works when you go into a hospital. We have these great electronic health records in hospitals
We
now.
sure do.
And they pay oodles, bundles of money. In fact, the University of Pittsburgh spent $1.3 billion on electronic health record that ties all of their facilities, all their doctors together. It's amazing. It was impressive.
Yeah, it is. Actually, Pittsburgh is one of the hubs of the electronic health movement, if you will, in this country.
That's right.
And it's lightning fast. And Rick Carter was on the show a couple weeks ago and with Q Shift, and he's moved down from that area, and he did all his training in Pittsburgh. So it is the health record movement. It's here to stay, guys. It's not going anywhere.
It is. But here's the problem. As wonderful it is, and by the way, like Rick, I trained in Pittsburgh, so I have a loyalty to them and impressed that my alma mater did such a great job. Here's the problem. As soon as we walked out the front door of the hospital, discharged my dad, with my mother with a bag full of drugs, and all kind of written instructions of what she was supposed to do, what she was supposed to do when they got home, all of that fell apart. There was no longer that connectivity that gave him that perfectly coordinated care. All of a sudden, my mother is on her own.
Right.
And as she gets home and she's trying to organize just colors alone of the pills of when they're supposed to be given and everything else, that's overwhelming. She gets my father back into bed at home. She wants to get him well. And then a knock at the door. It's a physical therapist. Another knock. Well, here's some equipment coming in. She knew nothing about this.
Right.
It was so fragmented that here were all these people coming to the door, unbeknownst to my mother, who has her own schedule, who has her own tasks to perform. All of a sudden, they start showing up at her door, and I thought, that's it. There's where I'll spend the rest of my life curing that. Because the reality is, we spend very little time in the hospital. Even when you're critically ill, you spend little time in the hospital. You actually recover at home.
That's true.
And we need that coordination at home or in the ALF.
Wherever they call home.
That's right. That's right. Whatever setting that is, that's where we need the coordination. That's where we need to engage the family, engage all those people that are showing up at your door to make sure that they coordinate when they're coming, the type of care that they provide, and then communicate that well with the family. And that's what's missing in our system right now. That part is missing, and we really have to address it.
Yeah, that I've seen that on a daily basis as well, where they come back from the hospital or a rehab center, they get discharged, and it's just overwhelming. You've got people who aren't trained nurses, social workers, or in the healthcare industry that are being thrown into a role, and some of them aren't even very internet savvy. Most of the younger generation, you can't get the phone out of their hands, and, they're Googling everything, which is now a verb, apparently. So it's changed, but the older generation, especially the baby boomers, that 1946 to 1964 age group, everything's changing very fast, and they are being thrown into this role, many of them, where you're the full-time caregiver, you're all that mom or dad has. So maybe what I can do is, one of the things I wanted to ask you is, so many families, parents are, I always say, the parents can push your buttons because they're the ones who sewed them on, So the parents can sometimes make adult children make promises that aren't very realistic. So say somebody says, my dad promised I'd never put him in a nursing home. Trying to honor that promise. I am trying my best. How would you suggest that reunion care can help in this kind of a situation? Because we see a lot of people staying home longer.
Absolutely. Absolutely. And in fact, even the state is trying to reduce the number of people in nursing homes and bring them into assisted living or back home. And there are a lot of great resources, one being reunion care. And the reason is, I talked about that we have all of the environmental assessments on there, and that's the best place to start. When you've promised to keep dad at home, the first thing you need to do is go into each room of the house, follow the guide that we have on there, answer every question. We go from floor to ceiling to make sure that you've looked at every aspect of that room. So You know, if I go back to my parents' house, the one I grew up in, when I walk in the front door, I'm certainly not looking to see if there are throw rugs that my parents are going to trip over or if mother's favorite serving dishes are up too high. That's not what I'm looking for. I'm looking to see if she made my favorite meal and are the beverages cold.
Yeah.
That's what you look for. And so we need to train you with new eyes.
Right.
We need you to walk into each of those rooms with new eyes and to really critically look for the problems. You know, one of the things that we fail to do is we fail to see if there are any, if there's external lighting on a house.
Yes.
You know, that's very important. Do all the windows lock? Do the doors lock? Mm-hmm. We take these things for granted, but it's things that you should do. You need to check. You also need to sneak into their bedroom and turn out the lights. Make the room as dark as possible and try to do the same tasks they do. Try to get up out of their bed and walk to the bathroom. Yeah. What are you going to trip over? Are you tripping over a dog, a pair of slippers that are sitting there?
The cat.
The cat, right. Is there something that they're holding on to that's really not steady?
Right.
You know, you have to do these things because unless you can walk in their shoes, it's not going to be a safe environment. We can create these environments at home. We can do nursing homes at home. In fact, there's demonstration projects now of hospital at home. We have so many technologies that can help us to do that. But the first thing you need to be able to do is to coordinate all the care that's coming in there. And that's what we specialize at Reunion Care. We specialize making sure that you are communicating with all of the health professionals that are coming in, but that you are engaged as a family and that you are aware of what resources you need.
So that's especially helpful if you have multiple adult children living in different states or different parts of the country, where they can go in and for instance, and see who mom's cardiologist is or who the primary care doctor is. And it's especially helpful because sometimes what we're also finding is the caregiver burnout.
That's right.
And it's helpful if, you know, the siblings know the signs or if the primary caregiver is having their own health issues, because that happens too.
That's a great point, Karen.
You know.
Yeah, that is a great point. You know, and for me, one of the issues, and I bet it's the same with your parents, if the doctor, God forbid, tells my mother she has an aneurysm, she's going to tell us she has a headache.
Right.
You know,
right.
She doesn't want us to worry. She has a headache. And the reality is, unless we know what's truly going on with her, we can't be as helpful as we need to be.
Yeah, my own grandmother was type 2 diabetic, insulin dependent, and I went through 2 pregnancies and without knowing this, because of course it wasn't my business. And especially when I was I was carrying my second child, and she was extremely large. And so my sugar was off, and I had to go to a neonatal specialist. Of course, neither my mom nor my grandmother thought to share with me that there's diabetes in our family.
Oh, my.
So, yes, this can happen regardless of training, education. Sometimes it's a cultural thing.
That's right.
They don't want other people to worry. I will take this on as the proud martyr.
That's right.
Myself. And but it is helpful to share health history, you know, regardless of your age, because, you know, it lets the doctors know if you're at risk for something. It just cracked me up because I was like, wait, what? You know, and it is hilarious to me that sometimes, I mean, in your case, you know, your parents are welcome the whole situation. And in my case, you know, my family was always very, very private about any health history, anything going on. They were the same way with money. For the longest time, I thought we were rich. Who knew? No clue. But the thing is that they really just are trying to manage it the best they can, like you said, and they don't want to burden others with that. So it is helpful. This tool is really helpful. When we're going to take a quick break, when we come back, what I want to get into a little bit more is your role with AARP and how this is coming together.
Great. I'd love to talk about it.
This is the Tan Talk Radio Network.
Are you caring for a loved one who needs more time and attention than you have to give? Arcadia Home Care and Staffing provides specially trained companions who provide personal care with an extra measure of warmth and professionalism so those you care about can have their needs met right at home. Keeping your loved ones in familiar surroundings can make a world of difference in their quality of life. Call Arcadia today, the Quality Home Care Service. All Arcadia caregivers are background checked, bonded, and insured. In Pinellas or Pasco, call 727-579-9414. Other areas, call 813-306-0007.
Listen, do you hear that? It's the sound of your senior care community's IT systems running smoothly. In this time of ever-changing regulations and requirements to share electronic health information, that's not easy to achieve. After all, you're in the business of taking care of people, not computers. Let the team at QShift, Inc. put our 30 years of healthcare IT experience to work for you. Think of us as ever-vigilant partners working to manage your electronic health records, IT planning, network security, systems integration, and IT training needs. With affordable solutions for skilled nursing, assisted living, and continuing care communities, the QShift team has the services for you. Why QShift? Because we're there for you every shift, every day. So go to qshift.com, that's CUESHIFT.com, or call Rick at 717-428-9020 to learn more.
This is the Tan Talk Radio Network.
Welcome back, Tampa Bay. We are here discussing technology and caregiving with Monica Stynchula, who is the CEO and founder of basically a patient portal tool called reunioncare.com, finding out a lot of different roles that she plays as well. So one of the things that she was explaining to me in the break was that she's the program director of the Caregiver Accelerator.com for AARP locally. So maybe, Monica, you can tell us a little bit more about what that is.
Sure. AARP, as we know, is a large membership organization. We have 38 million members at this point. And AARP has devoted themselves to the issue of caregiving for the next 4 to 5 years.
Great.
I was so excited.
Yeah.
I thought you've hit it right. You know, it's not just. Remember, AARP is now covering 5 generations when you look at its membership.
Right.
I mean, 5 decades, excuse me. So when you look at those 5 decades, there's a big difference between someone in their 90s and someone in their 50s. And caregiving really is an issue. When you're in your 50s and 60s, you're caring for your parents who are in their 90s.
Right.
And so it's a very important issue that we need to tackle. Mm-hmm. And so AARP asked me to be on their executive council. And I was very excited to do it. That gives me a voice to be able to keep promoting how important caregiving is for us and for their organization.
Yeah, because I've noticed through the years, AARP always had a very filtered approach to their educational role. So it's nice to see them getting into some of the meat on the bones a little more, these substantial issues that people really are challenged with.
Right. We have this great new president named Joanne Jenkins, and her whole philosophy is disrupt aging. I just love it. I mean,
great.
You know, it's like that boomer, it's the rebel thing. We're going to disrupt aging, and caregiving's a large part of that. So what happened is last year we had the White House Conference on Aging listening event here in town, and we helped to bring that here to town. And as part of that event, the state director, Jeff Johnson, tasked us with develop something in caregiving. Well, there were all these people from the AARP National in Washington that were sitting there at the table, and I kept picking their brains on what's going on, and I put together something called a Caregiver Accelerator. So what it does is it merges 2 important aspects of our lives. One is, how do we, when we get older and we need income, we need a job, and maybe we can't go back into the workforce because we're an older worker and we're finding a hard time getting back into the workforce. How do we create new employment opportunities? So either starting your own business or coming in on a startup of someone else's business. And how do we tackle the caregiving issue here on a local level? You know, here in Florida, we have 2.7 million unpaid family caregivers.
Wow. That's a big number.
It sure is. And when you look at what it means on a national scale, in 2009, the amount of money that was saved by family caregivers was more than the national budget for Medicaid.
Wow.
$470 billion. That's a lot of money But that's not sustainable. There's more of us that are getting older. We cannot sustain this model thinking families are going to carry this on their backs forever. Right. So as a result, we need local caregiving companies that can help to bring new solutions into our community. So let's say you're a retired carpenter and you can make some really lovely ramps that don't look institutional. You could have a business doing that locally. We can help you to put that business together through our Caregiver Accelerator. Okay. And then you can go out and have that business here locally. In fact, we'll even help find you customers because we're having a Caregiver Conference at the end. Let's say that you have a new way of doing Meals on Wheels, but Meals on Wheels on the spot. So if someone needs a dinner that night because something happened, that they would be able to call you and you would get that food to them. We have a lot of different things. Some are technology, some of them aren't technology. Some of them are hands-on services or different products that you can use in your home, grab bars, ramps, all different kind of devices for in your home. So what we did is we came up with this model of a Caregiver Accelerator, AARP National. The Health and Caregiving Vice President believed in what we're doing, and he gave us the money to do it. This is the only place it's being done right now, is right here in Tampa Bay.
Go figure.
We're really excited because we're not just looking for caregiving solutions when it comes to seniors, but we're looking for solutions that also appeal to veterans. Right. Disabled veterans or retired veterans, also with families that are taking care of a terminally ill family member.
Well, we know there's a lot of grandchildren that are caregivers as well. That's a huge market that gets largely overlooked.
That's right. That's right. So, caregiving isn't just an issue of taking care of your parents. Caregiving happens at so many levels. So we're out combing the community right now, finding the people that have a really clever idea that they'd like to turn into a company. And we're using a curriculum called Wendy Kennedy's So What? Who Cares? Why You? It's used internationally.
Kind of like a Shark Tank kind of thing.
Well, in the end, it will be. That's right. So after you go through the Caregiver Accelerator, in the end, we are having a pitch competition. Okay. And so we'll have judges that are here locally from the entrepreneur space. And we'll also have some that are national. So we'll do a pitch competition. The top 6 companies that come out of the accelerator will pitch. And we have some great prizes lined up that we are going to give them if they win the pitch competition. It's going to be broadcast live on AARP's website, so everyone can vote. Everyone can vote. We'll have a People's Choice as well as the Judge's Choice. Then the following day, we're having a Caregiver Conference. And this Caregiver Conference is something you and I have discussed before. We're really excited about it. We want to bring caregivers in. This is really to invite caregivers in. We will have respite for if you need to bring the person you're caring for.
And what day is that conference again?
May 18th.
May 18th.
At the St. Petersburg Hilton.
Okay.
And the pitch competition is May 17th at the Palladium in downtown St. Pete.
Okay.
And so on May 18th, we'll have a full day. We have retired General Tony Taguba. Tony Taguba is the one that authored the Abu Ghraib report, but he's here talking about what he does now, and that is helping people as they come out of the military figure out what's next, which is the same thing a caregiver faces when their time as a caregiver is over. What's next for me? Where do I go next? Yeah. And he's very inspiring. And so we're excited that he's going to be there. But the whole day is built around caregivers, creating resources and making sure that we have things that are useful to that caregiver. Right. And so we'll spend the day talking about legal issues, financial issues, caring for the caregiver, all kind of workshops and treat bags and different things just for the caregivers.
That's great. It's going to be a great conference. And I've learned in speaking at some of the other annual conferences for groups, I speak and travel all over the country, is they always seem to gravitate back to how do we pay for it, what programs are out there, because we know mom or dad need help, but how can we make sure to keep them at home as long as possible? And that seems to be kind of like the running theme, regardless if you're disabled younger or older. Also, you said that you had mentioned a little bit about telehealth, too, that's kind of a new thing that's hitting Florida. And I think our listeners really love to be informed on anything that's coming down the pipe here. So maybe you can tell us a little bit about that.
Yes, I was up in Tallahassee 2 weeks ago and spoke to the legislators about telehealth. It's a bill that's up in front of them right now. So let me explain what telehealth is. Telehealth means any kind of communication that you do that's outside an office visit. So whether it's posting a note on reunion care to the family members, whether it's sending a fax to someone, whether it's sending an email, or whether it's actually having a Skype call, a video call with someone that's at home. All of those are part of telehealth. The legislation that's in front of the Florida legislature at this point is addressing telehealth as any health professional working within the scope of their practice. So it has to be something that you would do on a regular basis, live, person to person. But now you can do it using all the technology that surrounds us today, which is they're doing it in other states.
Right.
We're doing it here in Florida, but here's the issue. We're not paying for it. So right now, what the telehealth bill is all about is how do we compensate healthcare providers for doing it? And it's really important that we do this. First of all, because the technology exists. And think of it this way. This is what I said to the legislators to appeal to them. Is I said, let's say you're caring for someone with dementia. And so you know that they have a doctor's appointment at 10 o'clock. What time do you think that day begins to get them to that appointment at 10 o'clock? 7 o'clock? 6 o'clock?
Easily.
Because you have all of that preparation, all of the activities of daily living that you have to do to get them ready. Then you have to drive, leave extra time to get out and get into the appointment. So if your appointment's at 10 and maybe you get into the exam room by 10:45.
If you're lucky.
Right. And then you have your appointment and it turns out to be a quick appointment. Now you have to reverse the whole process to get home. Now you've thrown off your lunch schedule. So all those medications that were supposed to go with lunch, that's all thrown off. So what we've done is we've taken a normal day and we've made it so abnormal, and all those tasks that are waiting for you are still waiting for you. Imagine if we were able to have that visit using our phones, our smartphones, and the doctor could do that recheck that you spent all that day waiting for that 2 minutes for that recheck, if you were able to do that on a scheduled time on your phone. Imagine if you didn't have to take a day off work because your kid had some funny rash and was starting to spike a fever. And if you could show that to a doctor and the doctor goes, oh, no, that's okay. I'll order such and such.
Right.
And put this topical cream on and call me tomorrow. Let's see how it's doing. Now you haven't missed a day of work.
Right, and it's basically incentivizing doctors not to call you back for normal results, too, because that's always been a pet peeve of mine. If the results are normal, why do I have to take, like you said, a couple hours out of my day to come back here for a normal result?
Right.
I mean, understandably abnormal results, and the doctors can decide the severity, but that's always been a big pet peeve of mine. If they're normal, why do we got to come back here? Come on. But I do understand what you're saying. They do need to be compensated. I'm pretty sure you're familiar with the Interact tool that a lot of the home care agencies are using.
Yes.
And they found the studies were pretty impressive and the stats were amazing that the home care agencies that did use telehealth, they called their patients after they discharged them. They had that relationship built so that if there was a problem, and that it reduced the rehospitalizations.
That's right.
By almost 40%. It was amazing.
Well, goodness, what's the main reason why rehospitalization happens? It's because there's a problem with the medication.
Right.
Think of it. If you had medications before you went into the hospital, you came home with a new bag of medications, you don't know which ones you're supposed to discontinue and which ones you continue. Right. The number one reason for readmission is that medication issue. Something goes wrong because you've done something wrong because you didn't understand. Imagine if you could place that phone call to a pharmacist and go, okay, now I have the same prescription. This one's at 10 milligrams. This one's at 50 milligrams. Which one do I give?
Yeah, that's huge.
It is huge. It is huge. And so telehealth has great benefit for us here in Florida. One of the main reasons why we at AARP are pushing telehealth is the waiting list for senior services. The waiting list right now is 59,000 seniors on a waiting list.
Wow.
And that is growing daily. There's a lot of things when it comes to that long-term service support that if we had telehealth, that we could mitigate those problems and we could get some of those people off the list, set them up with services quicker. Anything that we can do to reduce that list is helpful to our state and it's helpful to our individual seniors that are sitting out there just kind of languishing.
Yeah. I mean, it is sad because, we know that there's people that need the help. I've worked for years with seniors that were eligible for Medicaid or veteran programs, and sometimes the funniest comment I've ever heard was, "Well, why didn't you ever apply for Medicaid, for instance?" And one woman who was living on $800 a month, it was just heartbreaking. She's like, "Well, I kept getting the notices from Department of Children and Families, but I don't have a family and my children are all grown."
Oh.
And it was confusing. They didn't understand the process. So it is helpful if we can send in healthcare professionals to get them going on this. Our healthcare system, as I've been preaching, is very fragmented.
That's right.
Anything we can do to try to have some connectivity, and that was one of the things that Rick was talking about with the electronic health records. That we're moving that way, where the doctors and the hospitals and the hospital lists and the nursing homes all can see the same data, and so there's a clear picture. Where it breaks is when, like you said, somebody goes home or they go to assisted living.
That's right.
And those are the two components where there's that gap. And that's what we're finding. If we can close that gap,
absolutely,
anything that helps to close that gap is going to be helpful.
That's right.
To keep people out of the hospitals.
That's right. And telehealth has such promise when it comes to that. It's going to help all of us. If you live in a rural area, think of it, and you have a stroke. The fact that they could get a neurologist on the phone, on the video phone, your smartphone right away, and they're able to look at the situation with an EMT or with an RN standing there. If they can look at that and they can start the medication right away, they can mitigate a lot of the complications that come with a stroke. I mean, it's just amazing what we can do, but that connectivity has to be there.
Right.
Whether it's at home, assisted living, wherever it is, we need to be able to leverage that ability to reach out and talk to each other.
Yeah.
And technology allows us to do that.
Oh, definitely. I mean, our technology between social media, the internet, our phones, ironically, the GPSs, which didn't work so great this morning for you, sadly, but that it is, we're so dependent on it, but they are showing, there is the data to support that it's working.
Right.
So now, one of the things you mentioned is that sometimes, a lot of families out of state, they call mom or dad, I'm fine, I'm fine, and they don't really know. Now, you mentioned that specifically reunion care can help, because maybe you can discuss how that's helpful.
Oh, absolutely. I say that because it happens to me all the time with my mother. I'm fine. So what we do with Reunion Care is our calendar, everything that happens on our site, post onto a bulletin board. Okay. It'll remind you of Facebook when you look at that, but it's a closed system. But It will remind you, it's postings of activities that's happening on the system.
Almost like a notification.
That's right.
Okay.
That's right. So when you're sitting in a traffic light, you could take a look at that and see what's going on. But on the calendar, we list everything, including if she's going to church on Sunday, if she's going to garden club, if she's exercising on a regular basis. Everything gets listed on there, and there's a reason for that. Because when you call mom on Sunday, instead of saying, how are you, you can say, I see on Tuesday you went to the neurologist. Now, was that Dr. Michael or was that Dr. Stacy? And what happened while you were there?
Right.
All of a sudden, you have talking points that you can use to have a real conversation. Yes, some of that stuff is already posted on the site, but think what you've done now for your parent.
Right.
Orientation is a big issue when you're sitting at home alone. There aren't people around to talk to and to keep you oriented to what's going on every day. But if I'm calling and saying, so what did Dr. Stacy have to say about that tingling in your right hand? Now it brings her back to, now let me recall what happened on Tuesday, what's going on.
Right.
Or when you went to garden club, did you see Mabel? Was she there? And what did you talk about there? What we look for with Reunion Care is we're all about the psychosocial, what's going on psychologically and what's going on socially with you. The electronic health records have you covered when it comes to medical. We've already found that out. There's great promise with that. But we need to look at, that psychosocial side. What's going on a daily basis? How are you doing when you're there at home? And so we take every opportunity within our site to make sure that we have those connections, that we always are calling you back, as we call the people that you put around you when you use Reunion Care, your circle of care.
Yeah, I saw that on here for consumers.
And the reason why we do circle of care is, we want to make sure that the people that when you go to the hospital or when you have a change of scenery in any way, the right players are engaged. So we ask for your primary caregiver, your emergency contact, power of attorney, durable power of attorney, primary health care provider, all those people that we need to notify quickly if for some reason a crisis happens. That's your circle of care. Those are the people that we need to activate and get onto scene right away. Now, that doesn't prohibit you from having other people involved. If you want to go out and have your grandchildren on your site and everything else, you're certainly welcome to do that. But we need to know that those people that are responsible to help you in those situations, that we have them as part of your circle of care right around you, and that we can always get them and make them active for your care.
Yeah, so actually somebody who is living alone, it sounds like it's a great tool just for peace of mind for the rest of the family members to know how you're doing. And and I'm all about empowerment with this show and with my whole theme of work, is that the more knowledgeable an older adult is, and interestingly enough, at our senior empowerment day, we had close to 100 people that attended back in Largo, and the panel asked the attendees, what do you like to be called? Do you like to be called seniors? Do you like to be called elders? Do you like to be called adults? And the majority of them said, can't we just be humans? Can't we just be an older adult? Why do we have to be labeled? And I'm like, well, because everything, your senior discounts are labeled and everything else is labeled as seniors. So, but when it comes to that empowerment, if you have somebody, if you're an older adult yourself, and you want to stay home, you want to stay home safely, and you want your adult children to trust, this is a great tool for them, because they can communicate, or if they have a caregiver in the home, that caregiver can communicate on the website. She's doing great. She went to see the doctor. She's going to church. All of her activities of daily living are occurring safely. Mm-hmm. Just touching on the fall prevention too, for those that have that towels in the bathroom that match the shower curtain, that match the rug, that nobody's allowed to use those towels, that nobody's allowed to use. They've done studies. That's like the hugest fall risk. If they don't have like you mentioned, the anti-slip rugs in the bathroom, right. That's the biggest reason for fractured hips. Yeah. Most falls occur when you're going to the bathroom in the middle of the night.
That's right.
And that is the largest reason for it, is the fall. What are you tripping over?
That's right. Yeah, bathrooms are deadly places, I hate to tell you. But back to what you were saying about reunion care. Reunion care costs $4.99 a month.
Okay.
And anyone can start it. You can start it as the adult daughter. A grandchild can start it. Anyone can build a circle of care around whomever they'd like to build it around.
Okay, great.
And so we
certainly affordable. It's a cup of coffee.
But you said it, Karen. When you said peace of mind, that's what we want. We want to engage no matter where you're located. Right. If I'm sitting here in Florida and my mother's in Pittsburgh, we want to be able to stay connected so that when I'm sitting at a traffic light, if I look down and pull up my reunion care account, I can see what happened with my mother right there. It's peace of mind for me to know she's doing okay, or for me to get back to her. Now, even though it's $4.99 a month, with everything that you do on the site, we not only train you of why that's important, but we also offer you the opportunity to buy products for those areas. So let's say that my mother her arthritis is getting bad, and she can no longer do all those buttons on her shirt. So one of the things, so when we see her dressing skills start to decline on our ability tracker, one of our primary suggestions is to rearrange her closet. So take out all of those items that have all the difficult buttons and put the easy stuff to wear up front so that it's easier for her to get dressed. But if she still insists on wearing those things with all those buttons because that's her favorite jacket, there are adaptive devices called buttonholers, and they just help you to be able to do those buttons. Occupational therapists recommend them all the time.
Right.
We're going to have the opportunity to purchase those things right on our site.
Oh,
so
nice.
So that no matter where you are, if you want to engage and you want to be useful in your parents' care, that you can send products and have them delivered directly to their house. You know that they need grab bars in the bathroom, you can order them and have them sent right on. So here's my appeal to everyone out there. As caregivers, as adult children, as we take care of our parents, instead of sending a dozen of roses to your mother on Valentine's Day, please send a case of Ensure
Yeah.
Please send something practical, something that is really useful. Keep in mind that our parents live on fixed income. And even those parents of ours that have done well and they have substantial money to be able to go out and do things that they want to do, no matter who they are, we all worry about the future, having enough money for the future. And so anything that you can do that's practical, that helps them out on a daily basis, even though it doesn't seem as tender as that dozen of roses, let me tell you, it's much more useful.
Well, and I think the older a person gets, it's the been there, done that factor. Honestly, how many pictures, they seem to like really enjoy the pictures of the grandchildren and pets and things like that. But the practicality becomes so much more important. Their health and their wellness becomes so much more important. I mean, honestly, as we age, we suffer more losses. And as we lose things, we all go through our midlife crisis, I think, sometimes where we're losing our, the great skin we had, or the skinny body, or everything else. But when you get into somebody living into their 80s and their 90s, they've gone through substantially more losses. Right. And so the important things of health and wellness do become very important. Interestingly, when we did our anti-scam with the Largo City Police Department Senior Services Division on Saturday, and the exit interviews were amazing. They said, finally, we're doing more than a health expo. He's like, we don't want one gentleman, I think it was a gentleman, he wrote in, I'm so sick of those health fairs telling me how sick I am. He's like, I don't need to be reminded. And he said, finally, this is something much more substantial. We need to know about, and we had covered the criminal activity. We'd covered the bank. We had a fraud specialist come in, so they were showing some of the different ways that people were being exploited and being taken advantage of, and how to curb and limit charities and charity donations, and how to make sure that, if mom or dad are making donations, they're not just making it willy-nilly, that it's something substantial. Right.
I don't think that we, with our busy lives, have a real appreciation for the fact that phone call, even if it's a scammer, is a warm body, someone talking to them individually, and that makes them so vulnerable because they're eager to have someone to talk to you, and so that's why we want to do everything we can to keep them engaged. Those little touch points, those little opportunities to reach out and say, "Mom, we're still here. We may be busy, but we're still here." Right. We need those, and we need to exploit those as much as possible. Because
definitely. I mean, and I would encourage the older adults out there that, to embrace this technology, because as you embrace it, it's going to make the rest of your family have that peace of mind. They're going to trust that you're home, you're safe. I don't have to lay up at night worried about it. And I've noticed, and when it comes to aging gracefully, the most graceful elderly people I've ever met always were the most knowledgeable. They were usually retired nurses, retired social workers. You and I are going to be a nightmare when we're older, trust me. But they also knew how to vet a doctor. They knew what hospitals to be connected with. They knew what facilities they liked or didn't like. And they were making the choices. Right. They were calling the shots. Now, as technology is being thrown into this whole process, I'm seeing again that the grandparents and the parents that embrace the technology, now Facebook is more than just, puppies and grandchildren and whatever you had for lunch that day. But but I am finding that these tools like Reunion Care is a great way to let the family know, hey, I'm okay. I'm okay because, honestly, I've dealt with adult children that when mom and dad have a stroke or have had a problem, they go, well, she's 75, so she's not going to live that much longer. And I'm like, 75 is young. 75 is the new 65, is the new 55. Everything's shifted. And they can live well into their 90s. There's no guarantee of that anymore because between modern medicine, our preventative testing, electronic health records, and the influence of new medications, people are living longer. Right. And to their credit, and it's an exciting time, but it's also a little bit a little scary for some seniors and older adults. They see all this technology and they think, oh no, they're going to be able to have access to my bank account. No, it doesn't work like that. There's very much security measures on all of this stuff.
Right, to that point, in decades past, people died of acute illnesses. They died of pneumonia. They dropped dead of a heart attack. They did all those kind of things. Today, that's not how it happens. Mm-hmm. Today, we live with multiple chronic conditions, and those are managed by our healthcare providers. But as a result, we can languish for a long time, mm-hmm. and we just keep racking up the number of chronic conditions we have. Right. So 75 isn't really the drop-off point anymore. I mean, we have new realities that are out there, and we all need to remain connected to make sure that we can keep our parents at home, in the community, engaged with us as long as possible. And that's our goal with Reunion Care.
Yeah, and it's an excellent tool. I mean, I also work with an organization called the Retired Senior Volunteer Program. Mm-hmm. And a lot of older adults that aren't necessarily interested in the workforce, but are still very high functioning, are volunteering. They're volunteering in hospitals and at the VA system and art centers, and it keeps them, like you said, it goes to keeping them engaged, right. Having a purpose, having that unit of feeling togetherness with other people.
Right.
And it's a great program. I'm glad to say this is the first year we're actually probably going to have all the mileage paid for our volunteers, and that this is exciting for me because I've been on the panel for a few years, and I like things to get better if I'm on a nonprofit. I like things to keep moving forward. And,
that's terrific.
And we do a big volunteer appreciation luncheon for them in March, and down at the Coliseum down there in St. Pete by you. One of the things that I know a lot of people might ask is, well, if I want to get on Reunion Care or I want to build a circle for my relatives, and I see where you're talking about the sign up little button there.
Yes.
And now for providers, like say a physician wants to be part of somebody's circle of care, how does that work?
Well, we sell to providers. We sell directly to providers, and that's another level, another layer of Reunion Care, so that they can put all their patients on there and do all of their messaging and manage everyone from that level. So when you build a circle of care for your loved one, you can ask the provider to be a member of that circle on the front, or you can say to him, hey, Dr. Stacy, I think you should get Reunion Care to take care of my mother, and she can purchase it as a provider. And that's on a different level, and you see that on our website.
Yeah, I see that.
We've built a portal that's just for them, to make it easier for them to manage their whole census of patients at one time.
Okay. So it's really a very flexible tool. It's exciting. Really well done. Congratulations on that. One of the things that we always like to discuss here is the upcoming events. So remember, AARP is having their pitch on May 17th and their conference on May 18th.
Caregiver Conference, May 18th.
And that's free to the public as well?
No, it's $50 for the day. And It is at the St. Petersburg Hilton.
Okay.
And you will find it online under caregiveraccelerator.com.
Okay. And if you send me a flyer, I'll be happy to post it on agingguidebook1.com as well.
Wonderful. Thank you.
So that way we can try to get the word out for as many people, especially the caregivers. It sounds like it's going to be a great program and a great event. Now, for those of you that don't have access to the Internet and do want to purchase a copy of Navigating Our Healthcare System, you can do so by sending a $19 check to Elite Marketing at P.O. Box 7221, Seminole, Florida 33775. I get the cutest notes from people, so please feel free to give me feedback and send any letter that you want. I mean, one gentleman said, well, I need this because I need to stay above the ground as long as possible. And it was so funny. I was like, I'm still above the ground. So the purpose of this show, and we want to thank you, Monica, for taking some time today, is really to help empower and educate our seniors so that they are able to be living aging wisely and healthy and wealthy. So thank you very much and have a great day. We'll talk next week.
Thanks.